Okay, we're back. Ready to go even deeper.
Let's do it.
Into isolated raised ALP.
Yeah.
So in part 1, we talked about those first steps, like those key tests that help us narrow down whether the liver or the bones are the problem.
Yep.
We even talked about the 1.5x rule and that case of the 49-year-old woman with fatty liver disease.
Yeah, that was a tricky one.
Masquerading as an ALP mystery.
Exactly.
But like you said, there's a whole other layer to this story.
There is.
It's time to put on our detective hats
All right.
and consider those less obvious factors that might be at play.
Let's do it.
Okay, so let's start with medical history.
Certain medications can also play a role.
They can, yeah.
I remember you mentioning that in part 1.
Briefly, yeah.
And what kind of medications are we talking about?
Well, there's a whole list
of
medications that can affect ALP levels. Some common ones are antibiotics, anti-seizure drugs, even some over-the-counter pain relievers.
So you always want to get a complete medication history from the patient to rule out any drug-induced high ALP.
It seems like there are a lot of things to keep track of.
It does, yeah.
That's where good clinical judgment comes in.
Right, okay.
It's about weighing the different pieces of evidence, using our knowledge and experience to make good decisions.
Okay, that makes me feel better.
Good.
It's good to know. There's a human brain behind all those tests and numbers.
It's not just a computer.
Okay, so we've talked about medical history and medications. What about lifestyle factors?
Okay, like what?
Could things like diet
Right.
And exercise play a role in ALP levels?
Oh, definitely.
Okay.
We already talked about fatty liver disease. Mm-hmm.
And we know diet and exercise are really important for fatty liver. Mm-hmm. So making healthy lifestyle choices could actually lower ALP levels.
So New Year's resolutions to eat better and move more might actually be good for our livers.
That's right.
And our ALP levels.
2 birds, 1 stone.
Okay. But it's not just about fatty liver, right?
Right.
What about exercise itself?
Okay.
Could that directly influence ALP?
Well, there is some evidence
that
intense exercise can cause a temporary increase.
Really?
Yeah.
Okay.
Especially in people who aren't used to working out regularly. Mm-hmm. It's thought to be because of muscle breakdown.
Okay.
And enzymes being released from muscle tissue.
So if you're training for a marathon or, I don't know, trying a new workout class, don't be surprised if your ALP levels go up a little bit.
Exactly.
Okay.
It's usually nothing to worry about.
Okay.
Levels should go back to normal after a few days.
Okay. Good to know. But it's something to remember if you're getting blood work done around the same time as a big workout.
Makes sense.
Yeah.
Okay, so we've covered medical history, medications, and lifestyle.
What's next?
What about genetics?
Okay, good question.
Could our genes make us more likely
to
have higher or lower ALP levels?
Well, yes.
Okay.
There is a genetic component to ALP levels.
Okay.
Certain genes can influence how much ALP our bodies make.
Okay.
And how efficiently it's broken down.
Okay.
But it's not usually the main cause of significantly high ALP. It's more about small variations within the normal range.
So it's not like you can inherit high ALP disease from your parents.
Right.
But
your genes might play a small role in those normal ups and downs.
Okay.
It's just another piece of the puzzle.
Right.
Makes things a little more complicated.
Speaking of complex, I remember you mentioned something in part 1 about alkaline phosphatase isoenzymes.
Oh, yeah. Isoenzymes.
That sounded
a little technical.
A little technical.
Yeah.
Can you break that down for us in a way that even I can understand?
So remember how we said ALP is found in different parts of the body?
Yeah, like the liver and bones.
Exactly.
Yeah, okay.
Well, there are different types of ALP.
Oh, okay.
Each coming from a specific tissue.
Okay.
We call these subtypes isoenzymes.
Okay, so it's like ALP with a little ID tag.
That's a good way to put it.
That tells us where it came from.
Yeah, like a return address.
Okay.
And by measuring these different isoenzymes, we can sometimes get a clearer picture of where the high ALP is coming from.
So if we see mostly liver-type isoenzymes, we know it's the liver.
Exactly.
If it's mostly bone-type, then we focus on the bones.
Yep.
Oh, that makes sense.
It helps us narrow things down.
But I'm guessing this isn't a routine test.
No, it's not routine.
Okay. It's usually only done when the initial workup isn't clear.
Okay.
Or the ALP is really high, and we need more information to guide our next steps.
So it's like it's kind of a
secret weapon.
A secret weapon. Yeah, you could say that.
In the ALP detective's arsenal.
Exact.
Okay, so we've covered a lot of ground.
We have.
Medical history, medications, lifestyle, genetics.
Even isoenzymes. Yeah.
It's amazing how many factors can influence.
Add a lot to consider.
Something as simple as an ALP level.
Yeah.
But at the end of the day, what does all this information mean for our listener?
Good question.
What are the practical implications of this deep dive?
I think the main takeaway is that a high ALP, even when other tests are normal, it's often a puzzle, not a diagnosis in itself. It's a clue that we need to interpret carefully, thinking about the individual patient and all those factors we talked about.
Right, so it's not a reason to panic.
No, not at all.
But it's definitely a reason to talk to your doctor.
Yeah, absolutely.
And explore those potential causes.
Have a conversation, ask questions.
And don't be afraid to ask questions.
Right.
That brings us to another important point.
Okay.
Managing isolated, raised ALP.
Right. What do you do about it?
Yeah, we touched on this a little bit in part 1.
We did.
But let's go a little deeper into the different approaches.
Right.
Depending on what's causing it.
Good idea.
Because just knowing what's causing it, it's only half the battle.
Right. Right. You got to know what to do.
We need to know what to do about it.
Exactly.
And the good news is, in a lot of cases, the treatment is pretty straightforward.
It can be, yeah.
So if it's vitamin D deficiency, you supplement with vitamin D.
Exactly.
If it's Paget's disease, there are medications for that.
Yep.
But sometimes it's not about treating the ALP itself.
You're right.
But treating the underlying condition.
That's causing it.
Yeah.
Exactly.
Like with our 49-year-old patient.
Yeah. Good example.
Her ALP was a symptom of fatty liver disease.
Right.
So the focus shifted to managing that through lifestyle changes.
Lifestyle changes are important.
And those lifestyle changes aren't just for people with fatty liver.
Right.
They're good for everyone.
They are.
Eating healthy, getting exercise, maintaining a healthy weight.
All good things.
All of those things can help keep our ALP levels in check.
It's a win-win.
But let me play devil's advocate for a second.
Okay.
Some people might be thinking, okay, so my ALP is a little high.
Yeah.
But I feel fine.
Right.
Why bother with all this testing?
Yeah, I can see that.
And lifestyle changes.
It's a valid question.
What would you say to them?
Well, not every case of high ALP needs aggressive treatment.
Okay.
Like we said, sometimes watchful waiting is the right approach.
Okay.
Especially if it's mild and other tests are normal.
Okay.
But even then,
it's
good to talk to your doctor about potential causes and what you can do to stay healthy.
So it's not always about immediate treatment.
Right.
But more about
understanding the bigger picture.
Why,
exactly.
And preventing problems.
Yeah. Preventing problems down the road.
And
remember, early detection is key for a lot of conditions, including fatty liver disease.
Okay.
By making those lifestyle changes early, you can potentially reverse the disease and prevent complications.
So let's go back to those resources our listeners sent about fatty liver disease.
Yeah.
I know there's a lot more to discuss there.
There is.
And we'll have to do another deep dive on that sometime.
Definitely.
But before we move on, are there any key points
about fatty liver
that you want to highlight?
Well, the main thing to remember is that there are two main types.
Okay.
Non-alcoholic fatty liver disease, or NAFLD, and alcoholic fatty liver disease.
Okay.
Which is caused by too much alcohol.
Okay, that makes sense.
Both types can lead to high ALP.
Yeah.
But the way we manage them might be different.
Okay.
Depending on the cause.
Right, so it's all about individualizing.
Yeah, exactly.
Every patient is different.
To the patient.
Okay.
Okay.
It's not just about following a set of rules.
Right.
It's about using our judgment and taking a holistic approach.
Okay, so we've covered a lot of ground in part 2.
A lot of ground.
But there's one more piece of this puzzle that we need to explore.
Right.
We need to talk about what happens when all the tests are normal,
but the ALP is still high.
That's a tough one.
What do we do then?
Good question.
Sounds like a cliffhanger.
It is.
Our listeners will have to tune into part 3 to find out.
Stay tuned for the exciting conclusion.